Yep, we're ready when you are, Mahini.
So we'll just wait 30 seconds, yeah, till 6:30.
Sounds good.
Okay. Good evening, everybody. Welcome to West London NHS Trust Annual General Meeting for 2025. The aim of this meeting is to give a review of the year 24-25 and also demonstrate what we've done and showcase some of our services. This is a statutory requirement for the trust to maintain transparency and accountability and to showcase what the local NHS is doing. For the etiquette of the meeting, can I just please ask everybody to go on mute unless you are speaking or unless I've asked you to speak. If you have any questions, please submit them via the chat and we will have a question and answer session at the end of the meeting. Also, this meeting is being recorded. We'll have presentations from the Chief Exec, from our Chief Nurse, from our Chief Finance Officer, and also showcasing 3 of our services. I'd like to start, first of all, to a big thank you to Tom Kabasi, who was the chair of the 3 trusts and the chair of this trust for the last 12 to 15 months. As you know, he has moved on to a role in NHS2 in the Department of Health and Social Security. And I am the interim chair of the trust till we appoint a chair in common. With that, I'm going to hand over to Maria, who is the Chief Executive Officer. Maria, over to you, please.
Hi, everybody. Thank you, Mahini, for that introduction. And welcome, everybody, our staff, any partner organisations, and indeed any of our Hounslow community staff that joined the Trust this year. So I myself have been in post now for just over a year, and it's been a fabulous year at the Trust, and I've learnt so much, and I've felt a very warm welcome, and the sorts of specialness and uniqueness that makes West London a very lovely to work place. So what I'm going to do is do, as Mahini said, a bit of a look back of what we've done over the last year, and then I'm going to end on telling you about the sort of 2 or 3 things that we're really going to focus on the year ahead. So if we could move to the next slide, please. So most people, I'm hoping, are fairly familiar with this, but if you're joining from outside the organisation, a reminder that we provide local mental health and physical health services in the London boroughs of Ealing, Hammersmith and Fulham and Hounslow, serving a population of just under 900,000. Alongside that, we also deliver specialist forensic, community and inpatient services, and of course our specialist, one of 3 high secure services at Broadmoor Hospital. And I'm not going to read those stats out. People hopefully can see them. They are in the annual report. But I think what that actually demonstrates is that we've significantly increased the numbers of individuals that we see across all of our services, and particularly in our community-based teams. Let's move on. So this is our board. Hopefully our staff will be familiar with them. Perhaps a couple of things to call out. We've had some changes to our board. So from an executive perspective, last year we had 3 new exec directors join the trust, or not join the trust, join the trust board, I should say. So Dr. Claire Dillon, who's our Chief Medical Officer, Gillian Kelly, who's our Chief Nurse, and Mira Mistry, who's our Chief Strategy Officer. A thank you to Mahini for acting as our interim chair, and a very warm welcome to a new non-exec director who just joined this month, and that's Professor Jenny Quint. Next, please. So our staff, I think, is what makes the organisation so special. We're really proud, I think, to have a diverse mix of staff that really reflects the local communities that we serve. And we've had a really good response to our staff survey this year, and I think that's really demonstrated what a perspective our staff have in terms of wanting to work in the organisation and feeling that they can make a day-to-day difference in the care that they deliver. And there's some great examples of some of the things I think we've done to support our staff. So we have massively increased the number of apprenticeships that we're providing within the trust, and that's something that we will continue to deliver in the year ahead. We've also done an awful lot around refugee recruitment. So we have won an award for this, and I'll come on to that a little bit later, but we've done an awful lot to bring refugees into the NHS, offering over 100 posts, as well as I know 72 posts within our volunteering community. So that I think that's a fantastic.
Maria, you've gone on mute.
Yeah, I know. I don't know what happened there. I haven't touched anything by magic, but hopefully you can hear me. So our staff are what really makes the quality of care we deliver really important. So we put a lot of emphasis on making sure that we reward and recognise our staff for the work they do. So whether that's our monthly staff Team of the Year award, or Month of the Year, or our Employee of the Month, our Long Service Awards, or indeed our Annual Excellence Awards, are a really important aspect of making sure that our staff feel looked after, supported, and happy to continue to work with us. Let's move on to the next slide. So working in partnership is a really important part of what we do as an organisation that provides outward-facing community, physical and mental health services. We've got Tom to thank as our chair that has supported the 3 out of hospital trusts in Northwest London coming closer together. So Central London Community Health, Central Northwest London, and ourselves, which has allowed us to form a board in common to focus on some of the things that really will drive improvements for the patients that we care for across Northwest London. As a trust, we this year moved into a borough-based operational structure, and that was felt to be really important so that we could really develop those relationships with our local authorities, with our GPs, and make sure that we're in a really good position to support what's a really key plank of the 10-year plan, which is the move to neighbourhood working. And that's really important to do in order to establish local relationships. Operating in a borough-based structure is really essential to have the building blocks to do that effectively. On our specialist services, we work very well as part of our North London Forensic Collaborative, and very recently, actually, a good example of that is that we have opened a new ward for medium secure learning disabilities women's service on Damson Ward. And of course, we work closely with both Rampton and Ashworth as one of the 3 high secure hospitals, obviously ourselves being Broadmoor, providing particular support to Rampton. We're a buddy for Rampton in their improvement journey. So I think that demonstrates a lot of the work that we do externally across our partners. Next, so delivering our strategy. We've got 5 objectives, and I've given some little examples of some of the things that we've done to support that. So against collaboration and system leadership, you'll see that our North London Forensics Collaborative won a parliamentary award for the work that we've done working with our patients to develop forensic services that are effective and safe and high quality across the whole of North London. You'll see under population health a lovely example of our diabetes team. So here you've got Surinder Haran and you've got Diljit Sidhu, who have done some work with Desai Radio, reaching out to that local community to provide education and support around how you should manage diabetes. Putting our people first is a really important element, and here you see an example of one of our doctors, our trust doctor, Dr. Rupali Achara, who's won a Teaching Excellence Award for her commitment to mentoring undergraduate medical students. And then our Ealing Care Partnership has launched an exciting new pilot called Wellbeing Kitchen that's empowering our asylum seekers through cooking, and it's led by Katriana Marginas and Rosanna Jones. And then in terms of aiming for outstanding, we became the provider for Hounslow Community Services back in July last year. And that was a really important step for us to be able to support the next stage of integration between physical and mental health and our work as a partner in Hounslow Borough. So what I want to do next is pass it back to our comms team, Rubianka, who's going to show a very short film that showcases some of the great examples of work that we've done across the organisation over the last year. So Rubianka. Thank you. I hope perhaps we could just pop the slides back up when you get a moment. I hope that gives people a sort of flavour of some of the celebrations and some of the achievements across a really wide range of services across the organisation. So it makes me very proud to see that. If we can move on to the last couple of slides, obviously patient feedback is really important. We don't always get it right, but we certainly strive to get it right. And there's some lovely feedback that we've had here that we've included to give you a bit of a flavour across our different services. I perhaps will call out the single point of access. The service was my last resort. I didn't know where to get help. The service was professional and kept a watchful eye on me. I feel that I can call on them again if I'm in need of help. And that's the sort of feedback we want to receive day in, day out from all of our services. So finally, looking forward, what are our plans for the year ahead? So one of the things we certainly will be doing, and we have already done, and many staff on this call may well have contributed to it, is that we're in the process of refreshing our own trust strategy. We've got a 5-year strategy, and it's an opportunity to now look, reset, and make sure that we are focused on the right things. And in fact, that fits in very well with the publication of the 10-year plan as well. So it's a very timely thing to be doing. I mentioned that we moved into borough-based structures this year, and that's predominantly focused on our adult mental health services. So over the course of this year, we now want to push that further, and we want to be able to embed our physical health and our mental health services together over the course of the next 12 months or so. So we're continuing to do that work. Of course, our collaboration with Central London Community Health and Central and North West London FT will continue to play a very important part. And there's 3 major work streams that we're all focusing on over the next year. The first is around improvement. So what do we do together as a threesome to improve the service we deliver? And that's around making sure that we're offering a core mental health and community health offer, and that we're able to demonstrate the outcomes of the work that we're doing, and that we are productive in all that we do and using taxpayers' money effectively. The second key area that we're focusing on with our collaboration is place. So that's neighbourhood working and how we can provide an effective offer across all of the areas that we're working in. And our final area is a value work stream where we're going to be looking at how we can have a more effective digital offer across each of the three organisations and how we can streamline some of our corporate services to make sure again that we're providing as much as we can on the front line and making sure that our corporate teams are as effective and as small as possible. And then, of course, we've had the 10-year plan published last week. We probably anticipated quite a lot of the things that would be in that, and key parts of that will be making sure that we're in a good position to shift our work from hospital to community. So that's going to be a lot of work around neighbourhood working, delivering on a digital infrastructure that's going to enable us to make that next leap so that patients can access our services in a much more effective way than they currently do at the moment, and a much greater focus on prevention as well. So those are the key things that we're going to be focused on over the next year, and I look forward to continuing to work with all of you to deliver that. So thank you very much, Mohini. I'll hand back to you. Thanks.
Yeah, thank you, Maria, and thank you for showcasing through what, as you say, our staff are our biggest asset. So thank you very much for that. I'm now going to hand over to our Chief Nurse and our Chief Medical Officer to talk us through our improvements on quality. Gillian, Claire, over to you.
Thank you, Mohini. It's a real pleasure to be able to talk about quality and safety at the Trust and our progress for the year that's just passed. Can we move to the next slide? Thank you. So first of all, I just want to begin by introducing our quality account, which we published on the 30th of June. And this sets out our priorities and achievements for the year 2024-25. We very much developed the account together with key stakeholders, our partners across the system, and we work in accordance with the NHS requirements for this. Our account is centred around our priorities for 24-25. We had 7 priorities, 4 key themes and 3 supplementary. And across those 7 priority areas, we had a total of 40 work streams with all of them demonstrating some degree of improvement. 17 showed significant improvement and lots with good progress and early gains, which we'll continue to embed across the year coming forward. All of our priorities are underpinned as well by quality improvement methodology, which really allows us to track the progress and ensure that we achieve embeddedness in the areas that we progress. Next slide, please. So I just want to highlight some of the things that we've delivered and achieved through our quality priorities. So the first area is around our integrated pathways and whole person care. So one of the big highlights for the year has been implementation of PSERF, which is the Patient Safety Incident Response Framework. And this has really allowed us to enhance the way that we learn, to embed a just culture. And some of the things that we've done as a result of that is having lots of shared learning activity, academic sessions, away days. We have strengthen the way that we learn from complaints, from mortality and all of our patient safety incidents, sharing vignettes and newsletters and alerts so that all of our staff are learning together around incidents and things that do also go wrong. We have also developed a patient safety learning library, which has allowed us to really spotlight on the way that we learn as a system and on how we learn from the human elements of incidents, so the human factors. The other area I wanted to highlight was population health and health inequalities and co-production and how we've worked to drive improvements in those areas. So as Maria mentioned, we are part of a tri-trust collaborative, the Community and Mental Health Collaborative with CNWR and CLCH. And through this, we've developed some joint metrics around quality, so a shared scorecard. And this has allowed the Chief Medical Officer, Chief Nurses to identify areas for joint improvement work, for shared learning, and we've got a number of priority areas that we are working on together, things like pressure care, reducing catheter-acquired infections, and other things like restricted practice in the culture of care. In terms of co-production, there's lots to say, but I'm just going to highlight that we've developed brand new co-production training this year just past, with over 6 workshops held, which include patients, staff and carers all together learning about co-production and translating that into projects in the day-to-day delivery of care, and really doing that together hand in hand with staff and patients, shaping and improving how we run our services. The other areas to say about health inequalities is our patient and carer race equality framework has launched and really started to gain traction. We have spent time understanding our population inequalities and made lots of improvements in things like reducing restrictive practice, where we've made big strides in reducing things like our use of seclusion or rapid tranquilization, and recognising where there are racialised communities that have disproportionate use of these. So we've really transformed that and tried to understand through the development of more cultural competency in our workforce to better tailor the care that we offer around individuals' needs. And then finally, I'm just going to say something about the collaborative model of care before I hand over to Claire. So we've spent a lot of time this year developing our work around the culture of care. We have used the national standards for culture of care and taken each of our inpatient wards. We've undertaken a gap analysis and benchmarked each of the services against the standards, and then developed bespoke action plans with 3 wards on the national pilot. And they've been able to take forward change ideas such as developing sensory garden. We've also completely changed things like our visit times. So staff and patients have said having limited visit times on our wards was restrictive. So we've now lifted that across all of our inpatient wards and have a much more flexible model. And immediately we've seen improvements in everybody's wellbeing as a result of that. So lots of really great work emerging, and that will continue into the year ahead. And I'm just going to hand over to Claire to talk a bit more about innovation and then the year ahead.
Thank you, Gillian. So yeah, if we just go back one slide, the last box there is around innovation in service development and delivery. And we've already touched on a few areas where we've really made progress. But in terms of our quality improvement agenda, we've really built on the capability of the whole workforce in terms of having a sort of QI curious approach and making sure that people are trained. And then we're using a number of different QI methods across the trust. You saw earlier some of the posters that we've got at national and international conferences to share some of the successes that we've had. We've also got publications in the BMJ, and we've been sharing learning in Europe and across the country. We've got a number of strategic partnerships as well as the trusts that have been mentioned already. We've got a strong working relationship with the Royal College, and we've been doing a lot in the sustainability space as well in terms of reducing clinical waste, and particularly made progress with walking aids in our physical health services. And the fourth area that QI has been focused on, Gillian's already touched on, the sort of service user and carer co-production element, which runs through all of the aspects of care that we're delivering. So if we go to the last slide, so just in terms of the next few years, we see it as really important that the quality priorities are closely aligned with the clinical strategy. So the 3 headings remain for the clinical strategy, and these apply across all of our services. So we've got our forensic services, our adult and children's mental health, and our community services. And it's been really important to get engagement from our local clinicians, our local leaders, in terms of what the priorities should be. And a lot of them are already aligning with the 10-year plan, which is reassuring as well. So they're all underpinned by QI methodology, locally owned. And what we are doing is tracking the progress, myself and Gillian, and then reporting that up to the board. I've got a real focus this year on outcomes as well, and how do we think about outcomes? And that's not just outcomes that we can count, but also thinking about patient narratives, carer narratives, and how we capture improvement on an individual level as well as a population level. So there's still work to do, but huge progress, as Gillian says, over the last year, and we're really going to build on that and strive for high quality services across all of the services we deliver day to day. And it's really reassuring. We've got such a high level of engagement from all of our staff and all of our populations, so we'll continue to build on that. That's everything from us. So I'll hand back to Mohini.
Thank you, Claire, and thank you, Gillian, for the overview on quality and what we'll be doing over the next year. Paul, can I over to you now to talk us through our financial overview, please?
Thank you very much, Mohini. And of course, finance and quality go hand in hand. So for those that don't know me, my name is Paul Stefanowski. I'm Chief Finance Officer for the Trust. And just to say, this is my 10th year of doing this, and doesn't time fly when you're getting old? And of course, having fun as well at the same time. So I'm just going to briefly go through some of the figures that are contained in the annual report. So if you like numbers a lot, then there's plenty more to get stuck into in the annual report. So as you'd expect, my first slide has got lots of numbers in it. Just to help you read through that, you've got 3 columns of numbers. The first column is 23-24, so this is the position that I presented this time last year. The next column is the 24-25 position, which is the year just gone. And then just as a comparator, there's the movement between the 2 years. So like all good accountants, I go straight to the bottom of the table first to find out what the answer is and then seek to understand how I got there. So if you look to the bottom, last year I presented a surplus of 422,000. This year the surplus has gone down a little bit to 186,000. Our task is to break even, so I think 186,000 on 500 million is probably as close as you're going to get to break even. Just for information, clearly we do not want to be in a deficit position at the end of the year, and likewise we don't want to make too big a surplus either, because this is money that needs to be spent on patient care. So part 1 is done in the sense of we managed to achieve a surplus. Now just looking up the table, there's a couple of big movements, and starting at the top is 89 million increase in our income, and down the side of the table you see some explanation for this. Now clearly the most obvious thing is Hounslow Community Healthcare coming on board in July, so that's 39, that accounts for 39 million of that movement. Clearly that's only 9 months worth, so it's going to be closer to 50 million in the current year. So there's quite a big chunk of that movement that's from Hounslow. The next couple of bullet points are basically additional funding we got from the Department of Health, and this is to cover additional pay awards and employers' pension contributions. So that's a good 31 million just coming for paying additional pay awards. And those that aren't au fait with acronyms, the next one down, MIS and SDF, Mental Health Investment Standard and Service Development Funding. So we got increased income in order to provide increased services. And some of those has been kind of referenced in the previous presentations. And there's bits and bobs of additional income. So we got a big jump in our income last year. Mostly that has resulted in a corresponding increase in expenditure, as you would expect. And so you see probably the third and fourth movements, the negative ones, the ones in brackets, are kind of netting off a bit against the increased income. Just the final one that the eagle-eyed amongst you would have spotted is third up from the bottom, 8.5 million movement in I&E impairments, which is income and expenditure impairments. So this is what happens when every year we revalue our fixed assets, our buildings and whatnot. and the district valuer comes along and revalues them, and the difference between what we've got in our books and what the district valuer says is an impairment. Compared to the previous year, the impact was less, which is why you then see a negative movement, but actually it's a positive movement because impairment, you'd rather not have that impairment. So that was just it's more of a technical thing, but I thought I'd better just note it there because it is quite a big number. But all in all, successful year from an income and expenditure position. Just a little breakdown of that position on the next slide. So on the left-hand side, basically just a comparison of our pay costs compared to our non-pay costs. Almost 3/4 of our costs are pay costs. And if you compare that to your average acute trust, the average district general hospital, they're more likely to be about 60%. So there's quite a significant difference between the mental health and community trust and an acute trust. And I think it just goes to show what a people-focused organisation we are and how reliant we are on our staff for our successes and how important it is to develop and support our staff. So that's just a thing I always tend to kind of just raise it here because it does have implications sometimes for funding of pay awards that we keep going on at the department about. And on the right-hand side, it's just in terms of some of the categories, the changes in expenditure, what we spent the money on. Most of those have gone up because we had increased income and we had increased expenditure. Just a couple of very small things to note. Establishment costs, if you go to about 10 o'clock on that chart, going from 9 to 18 million. That's establishment costs, and most of that is down to coming up, Hounslow coming on board, and also a number of IT projects that we had this year just gone compared to the previous year. And interestingly, if you look just to the segment below that, the only one that's really reduced is what we call premises costs, which has gone down from nearly 15 million to 11.5 million. And actually, that is the impact of lower utilities bills. So that's how the kind of energy costs and the fluctuation in energy costs can impact on an organisation such as ours. And just a final one, up closer to 11 o'clock on that, other expenditure includes things such as professional fees, interpreters, subscriptions, and also quite significantly for us, the cost of land sales, so the preparation for land sales. And as you all may know, we are preparing to sell the old Broadmoor site, so that comes at a cost. That's just a kind of overview of the financial position. The other part is capital. So we have this artificial separation between revenue costs and capital costs. Capital costs is what you spend money on in order to on buildings and equipment and land. And for the year just gone, we spent 38.2 million compared to previously 32 against the plan of 32.3. So we were over the plan, and that was because the ICB, Northwest London ICB, had additional capital allocated to it that we then got a share of. Normally, our capital spend is between 20 and 25 million. So we were able to take advantage of additional capital expenditure this year. And it just shows some of the key areas of spend, mostly in terms of just trying to refurbish the estate, keeping the estate fit for purpose, but also about trying to increase our resilience around IT and our infrastructure there. And finally, there's capital work around health-based places of safety. So they're the key highlights in terms of what we spent that money on. Just a small thing hidden away in the middle paragraph. 5.8 million capitalized for right of use brackets lease assets. Basically, it's an accounting thing. Those buildings that we don't own, but we lease, we now have to capitalize. So that counts against our capital expenditure, those leases. So that's more of a technical thing. But overall, we were able to spend that money. We probably, if given the chance, could probably spend 3 or 4 times that money. Unfortunately, the NHS doesn't work quite like that way. But if it were to ever change, then we would like to be first at the queue, because there's plenty more that we need to do. Next slide, please. So just agency spend, because it's quite a hot topic, and you will see there our agency spend. So from 22-23, it's thankfully had a bit of a downward trajectory. It has been high historically within West London, but we have made a concerted effort to reduce our agency spend over the last couple of years, especially as our recruitment activities and have improved, and we've become a more attractive place to come to work. We don't need agency spend to fill vacant posts. So that we hope that trend continues. We are hoping in the current year to get that below 12 million for the whole year. Clearly, this is something that is also government policy, government aiming to eliminate agency expenditure by the end of the Parliament. So we've all got to try and trend in the direction of zero. Whether we ever get there or not is another matter, but I think we are going in the right direction, and we maintain that this is the best way to go, because actually the correlation between permanent staff and increased quality is quite clear for all to see. So long may that continue. And then my final slide is cash. Ultimately, cash is the way that we are actually to pay our staff and to pay our suppliers. We have had a reduction in our cash, around 15 million between the start of last year and the end of last year. The main reason for that, if you go back to the capital spend, we've probably spent between 10 and 15 million pounds more on capital than we might normally do so. And what happens is, when you're given a capital allowance, a capital resource limit to spend against, you don't necessarily get the money to go with it. We just get the ability to spend our money on capital, and we have chosen to do so. So we use some of our cash balances to pay for that capital expenditure. 52 million, 53 million for a trust our size compares very well actually with other trusts. And I don't see that as a concern at the moment. It's probably best off being spent on our assets rather than just sitting around in a bank account. To a level, we need to keep some cash available to us. So I'm quite comfortable with that. But that's, if you notice in the accounts, the cash going down, it's mainly because we spent it on additional capital spend. So that is that. So all in all, I would say another positive year from a financial perspective to complement the achievements that we've made in service delivery. My job is to present the figures, but it's down to the hard work of all the staff that I'm able to do so. So just as my final point, I'd just like to say thank you to them, to all of our staff, for another successful year. So thank you, and back to you, Mahini.
Thank you, Paul. Thank you for a very comprehensive overview of the numbers, and thank you to all the staff for all the work they have done to get us to this point. We're now going to be showcasing some of the services. We are a bit ahead of time, but I'm going to go with this. So can I hand over to Dr. Edith Albert, please, who is the consultant clinical psychologist. Is Dr. Albert here?
Yes, I'm here.
Oh,
thank you, Mahini. Yes.
Oh, over to you.
Yes, thank you so much for the opportunity to introduce to the AGM the London Major Trauma Psychology Network. London has 4 major trauma centres. They look after 10,000 patients a year. They provide highly specialist medical, surgical, nursing and rehabilitation team who care for patients that had serious life-threatening injuries, for example, following stabbing wounds, gunshots, road traffic accidents, and similar accidents. Historically, despite knowing that 30 to 40% will develop psychological difficulties, and that for 35%, this will reduce their ability to return to education and employment, Provision of psychological support for them and their families has been extremely limited. If you can have the next slide, please. In 2017 and 19, London experienced multiple terror attacks and the Grenfell fire. Many of the injured benefited from the specialist medical care that was provided by the major trauma centres and the coordinated physical healthcare pathways. Lessons that we learned from this incident showed us that the mental health care had significant gaps in provision and planning of short and longer term plans to address the psychological impact of these incidents. The major incident had ripple effects on the psychological well-being of individuals, their families, the bereaved, wider communities, professional responders, and can leave legacy of trauma on our communities. If you can have the next slide, please. Here are two cases that highlight the importance and the important need for integrated psychological care in major trauma centres for patients and their carers. In 2017, Westminster terror attack, a student was treated at King's College Hospital for his injuries. He was discharged with a plan for physical rehabilitation without psychological care. Travis suffered from nightmares and was not able to access care and has to raise funds for private psychological treatment. He became an activist for provision of mental health care for survivors of terror with the Survivors Against Terror network. On the other side of the slide, there's a colleague's son who was seriously injured by random stabbing in southeast London. He was airlifted to King's College Hospital, where his life was saved. He received no psychological care. And later on, I heard from his mum that he developed severe anxiety about leaving his mother's house, was anxious when he left the house, and was not able to resume his life with his partner and to return to his employment. If you can have the next slide, please. To address these two issues, in 2023, NHS England London established the London Major Trauma Psychology Network. The Pan-London project leadership is hosted by West London NHS Trust. London is acting as a pilot for an integrated model of care that allows for more equitable system of physical and psychological trauma care to both major trauma centres, MTC patients, and victims of major incidents. Psychology teams have been established in the 4 London major trauma centres to meet the psychological needs of patients and all age, from babies to older adults and their families. The care is offered on the ward as well as routine post-discharge follow-up care. The psychology teams also provide training to support colleagues in the multidisciplinary teams to deliver psychologically informed care and to support their well-being. These teams are also available to be stepped up when a major incident occurs, ensuring mental health and physical health responses to trauma are delivered with equal importance. At the early stages of the network development, we were already involved with the response to the Wimbledon and Hainault incidents. We convened and lead a London steering group that provides a system-wide partnership that includes emergency services, local authorities, NHS, voluntary sector, and input from survivors of major incidents that support and oversees the development of plans for coordination and delivery of psychosocial functions that will provide mental health protection, early identifications, and response by following evidence-based key principles for planning for psychosocial response to address mental health needs following major incidents. Our key priority areas for delivery include the following areas: coordinated response blueprint that include proactive outreach care to those directly impacted, plan to support communities and families, support for professional responders, communication plan to help reach out to wider community. The first year, we focused on developing and embedding integrated proactive psychological support for all age trauma patients. The second part of the work is the development of Pan-London coordinated psychological response to major incidents across major trauma centres, emergency departments, mental health trust, and local authorities. Next slide, please. So what does care for patients in the MTC looks like now? Sheila Thomas, a woman who was unable to walk after a serious car crash, recently talked about her care on a BBC News programme. In February 2024, when she drove to work, Sheila was caught up in a multiple vehicle pileup and had to be cut out of her car. She sustained injuries to her spine, brain, and hip, and needed help to walk again. But the impact was not just physical. Sheila also suffered mental health effects, including memory loss and anxiety. She spent months recovering, helped by the psychology team at the St. Mary's Hospital in Paddington. She suffered from lack of sleep due to severe nightmares and flashbacks and was very low in mood. Sheila said that she didn't realize mentally how the accident had affected her and that the psychology team helped her return to work and piece her life back together. In this BBC program, she described how psychological care helped her to be able to go out and do little tasks that people take for granted, like shopping, getting back into her car, and drive to work. She has also been able to return to the scene of the accident to lay flowers for one of the drivers who died in the accident. She described how this brought some sense of closure and was a huge step in her ongoing recovery. NHS England estimated that major trauma psychology will care for up to 2,000 patients a year. Psychology has been able to offer care for more than 5,000. The next and the last slide, please. As for the future of major incidents, we are now able to provide proactive care to patients that will be provided by the psychology teams at the major trauma centres. Psychology leadership will help coordinate multi-agency care for wider communities and first responders. Outreach with information and self-assessment tools to promote self-care and support for loved ones. Development of updated live information on West London's website that will be promoted by other hospitals, local authorities, Greater London Authority, police and emergency services. Thank you for listening, and I'll be happy to take questions in the allocated time slot.
Thank you, Dr. Albert, and I know this is really important work because the impact of major trauma on mental health is just huge. So thank you for all the work that you are doing on this and for showcasing this. We're going to talk now about some of the research that's happening in West London Forensic Services. And if Dr. Nicholas Stokes is here, I'd like to hand over to him. Is he here?
Mahini, I think it's the wrong way round. I think it's the UNICEF first.
I do beg your pardon. I do beg your pardon. It's first to Sarah Harris talking about health visiting in Hounslow. Sorry, apologies, Sarah. Over to you.
Okay, no problem. Hello, everyone. So thank you for having me. I'm just going to spend a few minutes talking about the Baby Friendly initiative and how here in Hounslow we have incorporated the baby friendly standards to help support our families with infant feeding. Can you just go on to the next slide, please? So what is baby friendly and why is it needed in the UK? So the Baby Friendly Initiative is a global programme of UNICEF and the World Health Organization, which works with public services to improve practice so that parents are enabled and supported to make informed choices about how they feed and care for their babies. So healthcare facilities like ours, which adopt practices to support successful breastfeeding, receive the prestigious UNICEF World Health Organization Baby Friendly Award. So in the UK, the Baby Friendly Initiative is commissioned by various parts of the health service to provide advice, support, training, networking, assessment and accreditation. So if you wanted to find out more information about that, you can have a look on the babyfriendly.org.uk. So the Baby Friendly Hospital Initiative has been adopted throughout the world. It was introduced as a joint programme of the World Health Organization and UNICEF to help address poor hospital practices and aggressive marketing by formula milk companies, which together contributed to a worldwide decrease in breastfeeding from the 1950s onwards. It came to the UK in 1994, and the community aspects of the programme was introduced to provide an equivalent set of standards for the work of health visitors and other community-based staff like family hubs, children's centres, with the aim of addressing the decline in breastfeeding continuation rates, so after the babies, have been discharged from hospital. We have come a long way since our certificate of commitment back in, as you can see on here, in 2018. And then we achieved stage 1 in 2019 and went on to stage 2 in 2020. Then COVID, I think, hit around that time. But we have as a team worked incredibly hard, especially over this last year, to achieve what we have in place for our families today. We had our initial assessment this was for stage 3 full accreditation in January this year, and we received some amazing feedback from the assessors, so we're really proud. We have our second part assessment towards the end of this year, and we do hope to be holding the full accreditation award by then, fingers crossed. Next slide, please. So how have we been innovative over this last year? Well, we have put a tremendous amount of effort into developing new ways of working over this last year that really do help support mums with their breastfeeding journeys, enabling them to achieve their feeding goals. And this is also reflected in our breastfeeding data. So we've been collaboratively working with services across Hounslow, like I said, family hubs and children's centres. We have infant feeding drop-in sessions now available 6 days per week. We have developed this year an in-house infant feeding team, and that's to support breastfeeding with telephone advice and also offering at-home support. And this is for mums that are unable to get out to the drop-in sessions, so we can go and help them within their homes. And that would be for someone, for example, who's maybe had a C-section or multiple birth, or maybe they do have mental health issues and just are unable to get out to the drop-ins. We have introduced a 4-week infant feeding follow-up call where we reach out to our families, because we know that sometimes people, when they have issues, they don't ask for help. So this has been really successful. We have now a breast pump loan service at 3 of our family hubs in Hounslow. That's one in Feltham, Hounslow and Brentford. We have developed this year a virtual Introducing Solids workshop, and we run that monthly, and that's becoming really popular. We continue to do regular audits and evaluation of service, because we're always looking at new ways, of course, to improve and develop further. We have many breastfeeding friendly places now across Hounslow, and we have information of that on the London Borough of Hounslow website. And we continue to run a full BFI staff training programme, not just for health visiting, but also out in the community with children's centres and family hubs. So next slide, please. So these are the Baby Friendly Initiative Achieving Sustainability Standards. And I am very proud to say that we passed in all of these areas, which is really good. So that's policies and guidelines. There were no advertising of breast milk substitutes, thank you. All our written information was all up to date and evidence-based, and that was passed. The leadership team, audit and evaluation, and they were really happy with our collaborative working, the way we're all sort of working together. And then if we go just to the final slide. So this is just some of the feedback that we got from that big assessment that we had in January. So I'll just read a couple here. So I've had a difficult breastfeeding journey, and all staff were supportive and helpful in the centres. They were not just baby centred, but treated us as a unit, considered our mental well-being as important. Support has been amazing. The health visitors were so lovely. They cared for me just like I care for my baby. Now I know about the children's centres, I no longer feel isolated. I feel part of the community. What an amazing service. The fact that it is free is a phenomenal, if I can say that word. I wish they had advertised this in the hospital. At the group, they watched her latch and never made you feel you had to rush. They gave you 100% of their time. All the support we have received has been top-notch from both health visiting and family hubs. And that is just a snippet of all the comments that we had on that assessment. So it was just to share all of that with you, and I'll hand you back to the chair.
Thank you. Thank you very much, and thank you for showcasing the work that you have done. Thank you. And the last presentation is a spotlight on research. Dr. Stokes.
Good evening, everyone.
Hi. Over to you.
So yes, so my name is Nick Stokes. I'm a consultant clinical psychologist, and I'm also the research lead for West London Forensic Service. So I'm going to be talking about research and why it's important, and some examples of what we're doing within West London Forensic Service. Next slide, please. So this is a view of the entrance to the Three Bridges medium secure unit, which is the largest of our 3 inpatient units on the St Bernard Hospital site. As you probably know, forensic mental health services provide specialist care for individuals with mental health difficulties who require secure care due to risk to others. Often our service users will have had contact with the criminal justice system and may be receiving assessment and treatment in hospital instead of prison due to mental health difficulties. In West London Forensic Service, we've had a particular focus on research in the last few years, and I'd like to share with you why we think it's important and some examples of what we're doing. Next slide. So why is research important? Well, the first reason is there is a lot of evidence that healthcare organisations that are research active tend to deliver better clinical care. Secondly, there's also evidence that where there's research going on within a service, you tend to get higher service user confidence and satisfaction in those services. There's also evidence that research helps with staff recruitment and retention and job satisfaction. And finally, of course, it helps to advance the knowledge base and develop treatments for the future. Next slide. So one of the difficulties with research is that it takes time and resources, and it can be very difficult for clinicians to fit in alongside busy clinical roles. So we decided to bid for some funding to support research activity from our provider collaborative, the North London Forensic Collaborative, who commission our services. So this involved 2 research assistant posts, protected time for clinicians to engage in research, and also funding for service user involvement. Next slide, please. So I'm glad to say that we were successful in our bid, and this has had a really significant effect on research activity within the service. So this includes a significant increase in the number of research studies that we have going on and in the publications resulting from those. We've also been able to establish very active service user research involvement groups within the service. And earlier on this year, we organised a research conference together with other trusts in the North London Forensic Collaborative, which was very successful. And I suppose in general, we're in the process of developing a research culture and making the service a place where that's receptive for research to take place, and where staff and service users are really engaged in the process of research. Next slide. So there are lots of different research studies going on within West London Forensic Service. But I was going to talk about one of these, which I think can illustrate how research can benefit patients and improve care. So Game Change is a virtual reality program developed by Oxford University, which aims to help patients with psychosis overcome agoraphobic avoidance. Now, agoraphobia, the fear of open and crowded spaces, is common in individuals who have psychosis, such as schizophrenia, and also common in forensic mental health service users, where schizophrenia is the most frequent diagnosis. So Game Change has been shown to be effective in a large research trial that took place in other settings, but has never been tried before in a forensic mental health setting. And we thought it would be particularly relevant for our service user group, as access to the community is typically quite restricted for our service users, and often length of stay in hospital can be quite long. So the virtual reality therapy allows for gradual exposure to different community scenarios in the virtual world. And the reduction in fear and anxiety within the virtual world can then translate to the real world, because the virtual reality experience is very sort of immersive and mimics your experience of being out and about in everyday scenarios in the community. So on this slide, you can see on the bottom right, so just to the previous slide again, on the bottom right is a picture of someone wearing the virtual reality headgear and the controllers. And the top right, you can see the scene that he would be seeing through that equipment. So as you can see there, it's like a GP surgery. To the next slide. So on this slide, you can see some examples of the different community scenarios that Game Change allows you to get used to and gain confidence in the virtual world. So as you can see there, there's a street scene, a bus, a cafe, a GP surgery, a shop, and also a pub. So we're really excited to be able to start offering this to our patients as part of a research trial, which is due to start in the next couple of weeks, in fact. What we're hoping is to be able to demonstrate that this is a feasible and effective treatment to use in forensic mental health services. And if we can demonstrate that, then in the future, this may become standard treatment for people with these sorts of difficulties in our services. So this is just one example, but I hope it's given you a quick insight into why research is important and just what we've been doing in recent years within West London Forensic Service. Thanks very much.
Oh, thank you, Dr. Stokes. I mean, this is really interesting to see the application of new technologies into improving therapeutic and outcomes for patients. Thank you very much for sharing that. And it's well known that organizations which do research always provide better clinical care. So thank you very much for all your work on this. So that brings me to the end of the formal presentations for today. And we have some time for question and answers. Sarah, I can't see anything in the chat on questions. Have we got any questions at all?
No questions in the chat, Mahini, no.
Okay. If not, we can actually close the meeting unless there is anything else we need to bring up. Maria, you I've got somebody who's put their hand up.
Hello, my name is Jenny Daly. I'm an AMP in Hammersmith and Fulham, and I'm also trying to set up a research project for which I got some NIHR funding, and it's looking at trying to co-produce a research question with people who are involved in mental health act assessments, so including people with lived experience, carers, doctors and AMPs. So just at the very beginning stages of that. And my question really was, and my interest is around co-production and how that can be done effectively. And I was really interested to hear that West London are involved, or some wards are involved in the Culture of Care initiative, which seems really exciting in terms of implementing and changing cultures on wards. In terms of valuing lived experience and developing processes to involve people, patients, carers in all aspects of service delivery. So I was just curious to know, I guess particularly in Hammersmith and Fulham where I work, in terms of the co-production that Gillian, you mentioned, like on the ground, like what does that look like for people that use or under mental health services, community teams, even inpatients? Like what are the channels that are visible to them in terms of how they, can get involved in services, developing services, quality insurance, evaluations, all aspects really of services, and how can they feel that their experience is being valued and heard and is being used to shape services.
Okay, so Gillian, the question around co-production, and I know you've done a lot of work on this. So question, can I hand over to you to answer that?
Yeah, no, thanks for your question. I think for me, it takes so many different forms. What we want is a culture where everyone thinks to work together, side by side with patients, so that they're as involved in every aspect of their care. So some of that is about equipping people with the confidence and skills to do that. We've got loads of good practice already where people, really work together to co-produce, say, someone's care plan. And so very sort of day-to-day, everything matters. And doing it together, and the patient's voice being at the heart. So there's still work to do in getting that as part of everything that we do. But, it is developing. We're doing more and more care planning where it's written and owned really by the individual patient in that sort of first person approach. So that's one level. We might want to connect outside of here, and I can also link you with Alex. But I would just say that through the culture of care in particular, it's got co-production at its heart. It's got trauma and autism-informed care at its heart, and inequality. So you cannot do that work without taking into account people's lived experience, without hearing their journey and understanding what's happened to them, not what's wrong with them type mindset. And so we're working really closely in Hammersmith with Gemma and others around how do we use things like the stabilisation resources around trauma. So we're starting to develop co-produced training with lived experience as part of the training team, to make sure that we can have trauma-informed care at every level with every patient, using the stabilisation model that actually CNWL have trailblazed. That's an example of how we've learned across. We shared the resources in the booklets, and now we're doing an implementation plan. So there's just so many different aspects to this around patient voice. I think we've got so much to do, but there is also lots of community groups, there's peer support groups. Our website's now got a touch point where people who want to get involved to develop and enhance services can access, join, see what we're doing, link up. We're paying people for their time to be involved, so that people's precious, time is acknowledged, and that we are much more, making sure it's equal. Do you know what I mean? That we're working on this together, whatever your role, staff, patient, carer. So yeah, it'd be interested to hear more about your sort of focus on that, what you're seeing and what you would like to see. So I'd really be happy to continue that conversation.
So Gillian, I suggest you pick up outside this room,
sure.
and pick that up there. Claire.
Yeah, I was just going to pick up the research element that you mentioned at the start, because Nick's focused on research going on in forensics, but we're in the process of recruiting an R&D director. I hope by tomorrow we'll have a successful appointment, and so I will link with you separately about research as well, because it'd be good to hear what you're doing, and also think about the co-production elements within research as well. So thank you.
Yeah, that's something for us as a trust to really amplify, because it's really important for staff and obviously for patient care. Any other questions? Okay, if not, thank you very much to all the presenters who've taken the time to do this, and thank you for showcasing the work that West London is doing. And thank you to all our service users, patients, families, carers, all our staff and our partners to allow us to continue to do what we do locally in the 3 boroughs where we provide services. And with that, I'm going to draw this meeting to a close, and have a good evening. Thank you.